If your legs feel tight, heavy, numb, or if they cramp even just a little bit, you need to hear this video. Most people think, I'm just getting older, or I'm probably a little bit dehydrated. Maybe that's it, or I overdid it yesterday. But in adults, especially over 50 years old, these leg symptoms are often your very first warning sign of clogged arteries in your legs. And clogged arteries in your legs means clogged arteries in your heart and your brain. So this can be a big deal. Here's the part most people never hear. Your legs often tell the truth about your circulation long before your heart does. In this video, I'm going to show you the early signs of peripheral artery disease. We'll call it PAD sometimes. The leg symptoms almost everyone ignores. The hidden metabolic problem that drives peripheral artery disease in the first place. And the number one simple, proven strategy that reduces peripheral artery disease pain and helps people walk faster and further without surgery, without more medications, and without pain. And if you've ever had to stop in the grocery store or on the sidewalk because your legs just wouldn't go, stay with me. This could change the next decades of your life. I'm Dr. Ford Brewer. I'm a preventive medicine specialist. I ran the program at Hopkins in preventive medicine, and for over 40 years, I've helped people find, understand, and reverse artery disease before it turns into a heart attack, a stroke, or a major disability. Let's start what PAD really is. Think of your arteries like living pipes. They're strong, they're flexible, and they can even move a little bit. The inside lining is smooth, kind of like Teflon. Blood is supposed to flow through them quietly, without a lot of turbulence. PAD, or peripheral artery disease, happens when that inside lining gets irritated and inflamed over and over again, month after month, year after year. Once it's inflamed, it's no longer smooth like Teflon. It becomes more like Velcro, rough and sticky. And when it's sticky, things start to cling to it. Things like cholesterol particles, bits of fat, cellular debris, inflammatory cells, immune cells. Your body tries to patch the irritation, but instead of clean repair, it's like slapping chewing gum on a leaky pipe. Over time, these little patch jobs build up and harden. The pipe, your artery, gets narrower. When that happens in the arteries that go to your legs, you can still sit and rest just fine. But when you start walking, the muscles in your legs need more blood. They need more oxygen, and that narrowed artery just can't keep up. At first, the symptoms whisper, then they talk. Eventually, for some people, they shout. There's one early leg symptom that almost nobody connects to circulation trouble, and it shows up long before classic pain when walking. I'll tell you exactly what that is in just a minute when we talk about symptoms. But first, let's talk about why this happens. If you ask most people why arteries clog, they'll say, well, it's cholesterol. That's what my doctor told me. LDL, HDL, statins, all of those things can matter, but cholesterol's clearly not the whole story. In fact, it's not even the biggest part of it. The deeper problem behind PAD, heart disease, and a lot of other chronic conditions is something called prediabetes, insulin resistance. You may have heard that term. Every time you eat, especially foods that have starches or sugars, carbohydrates, your blood sugar will go up. Your body releases insulin to move that sugar out of the bloodstream and into the cells. For a while, that works. But after years and decades of too much sugar, those parts of the cell we call insulin receptors, as they get older, they don't respond as well to insulin. The cells start tuning out the signal. They become insulin resistant. That's how that name came about. Now you've got two problems. Blood sugar staying higher than it should, and now insulin is staying higher than it should be. Both of these drive inflammation. They irritate the artery lining. The smooth surface becomes rough. It turns into Velcro. Plaque starts to form. This happens even while your fasting blood sugar and sometimes even your A1C can look normal. If that insulin is too high, we see that all the time. That's why so many people are walking around with PAD, peripheral artery disease, or plaque in their arteries. It can be arteries to the leg, it can be arteries to the brain, and it can be arteries to the heart. And their labs, or at least the labs that their doctor is getting, just don't look that bad on the surface. Peripheral artery disease, for many people, is really a metabolic disease that shows up in the legs first. You're not just dealing with bad pipes, you're dealing with a problem in the fuel system, the way your body handles sugar and insulin. Now let's talk about symptoms. The textbook symptom of peripheral artery disease is called, geek warning. Don't have to know it. Don't have to remember it. The doctors call it claudication. It's basically just pain and cramping or tightness in the legs when you walk. And it goes away when you rest. So let's talk about what's happening. If you think of those muscles in your legs like engines, which is what they are, walking is like pressing the gas pedal. The engines need more oxygen in the blood. If that artery is narrowed, not enough oxygen can get through. The muscle complains, it hurts, it burns, it feels tight, it cramps. You have to stop walking. The demand then goes back down when you stop walking, and then the pain fades away. That pattern, pain with walking, relief with rest, is the classic sign for that term that the doctors call claudication. Your muscles are cramping up, they're burning, they can't get the oxygen they need. Now, here's where a lot of people get into trouble. Peripheral artery disease doesn't always act like the textbook. Some people hardly get pain at all. Instead, they notice tired, heavy legs, cold feet, even when the room is warm, numbness or tingling, shiny, thin skin on the lower legs, sores on the feet or toes that are slow to heal, less hair growth on the shins, and sometimes nothing, no symptoms at all. The body quietly reroutes blood through smaller vessels, and you feel okay, until one day, there's a non-healing wound or a sudden clot or even a stroke. Let's get back to that early warning sign I mentioned earlier. One of the most important early warning symptoms I see or sign is before full-blown pain is just leg fatigue. It's not just I'm out of shape. It's more like my legs just don't work like they used to. People will say, I used to walk all over the grocery store, and now I need the cart just to lean on it. I'm not out of breath. My legs just feel like they ran out of gas. That quiet, early leg fatigue, especially if it shows up on both sides and gets worse with walking, is a major clue. There may be a circulation problem. If that sounds familiar, you don't need to panic, but you do need to pay attention. Let me tell you about George. That's not his real name, but we'll call him. George was in his late 60s. He's always been active. He worked in the yard, played with his grandkids, walked the dog every morning. But then over a couple of years, he noticed something. At first, he thought, well, I'm just getting older. The yard took longer. He started using the riding lawnmower more and more, and the push mower less and less. And this seemed to just happen all of a sudden, just over a few-month period. By the time he saw us, this is telemedicine, he could barely walk from a parking lot into the store without stopping. His legs weren't just sore. They felt weak and heavy, almost like someone turned the power down. He'd already been told by one doctor, you're just deconditioned, walk more. Another doctor said, it might be your back. Why don't we start doing some x-rays and MRIs? When we looked at him, it turns out he had PAD, peripheral artery disease in both legs. And he also had significant plaque in his heart arteries. His legs were the early warning sign. Everyone was listening to the excuses. No one was listening to the legs. Stories like George are exactly why I made this video. Now let's talk about what you can do to reduce the risk and slow the disease. Lifestyle changes. They can sound vague and soft, right? Eat better, move more. You've heard that 1,000 times. It really doesn't make a whole lot of sense, and that's what my patients say as well. But the science around certain patterns is actually very strong, and it's not that vague. One major study in JAMA looked at a Mediterranean-style diet. Believe it or not, and hang in there, I know we've got a lot of very low-carbers listening that don't like Mediterranean diet. This was a Mediterranean-style diet with extra virgin olive oil and nuts. The group using olive oil and nuts had about a 30% reduction in major cardiovascular events, heart attacks and strokes, and that was compared to more of a Western standard American diet. Here's what I think about it for PAD patients, peripheral artery disease patients. A lower carb Mediterranean-style diet works even better for most people with peripheral artery disease. It doesn't just help cholesterol, it helps lower insulin spikes. And we have tons of patients on keto diets, ketovore, lion diets, different versions of carnivore diets. Those help. We even have patients on vegetarian and vegan diets. But again, you just need to watch your carbs, especially those high glycemic carbs, the carbs that increase your blood sugar and therefore increase your insulin. Because remember that resistance to the insulin, or what they call insulin resistance and inflammation, these are the things that are driving the damage. High blood sugar and high insulin. for hour after hour. That's what drives the damage because it drives inflammation. Inflammation is what's damaging that artery lining. So what does this look like in real life? Plenty of non-starchy vegetables, healthy fats like olive oil, nuts, avocados, and yes, I'm totally fine with saturated fats. I just don't eat a lot of them because I gain weight when I do. Moderate amounts of protein, very limited sugar, very, very limited refined grains. Watching starches like bread, pasta, rice, potatoes, and keeping portions small or replacing them. The goal is not perfection, at least it's not for me. The goal is to avoid chronic sugar spikes, keep insulin down, keep the arteries in a calmer, less inflamed environment. That's one of the most powerful long-term strategies to slow peripheral artery disease and to reduce risk in the heart and brain, too. Now, let's talk briefly about medications. Nobody loves adding more pills. I don't either. But for some people with peripheral artery disease, medications can save lives and limbs. I'm not treating you personally here. I'm just explaining categories so you can have a better conversation with your doctor. There are 3 big players in the prescription medication space. Antiplatelet drugs, for example. These include aspirin and, again, a geeky name, clopidogrel. Think of platelets as the sticky pieces in your blood. When the inside of an artery is rough or narrowed, platelets can clump and trigger a clot. Antiplatelet drugs like just plain old aspirin and clopidogrel make the blood less sticky. They've been shown to reduce heart attacks and strokes in people with peripheral artery disease. Another geeky term, rivaroxaban. And this is a combination. This next one is rivaroxaban or Xarelto. You may have heard it by the brand name, Xarelto. For higher risk patients, especially those who've already had a procedure or have disease in multiple areas, studies like the COMPASS study and the Voyager PAD showed that low-dose Xarelto combined with aspirin helped reduce heart attacks, strokes, and limb-related problems. This combo also increases bleeding risk. So it's not for everyone. This is for people with very, very serious disease. It's a balance. Now, there's a third one. It's called cilostazol. Cilostazol is interesting because it's one of the few drugs that helps with symptoms directly. Another geek warning, it's a PDE3 inhibitor. It slightly opens up the arteries, and it makes platelets a little less sticky. And in studies, it's helped people walk 40 to 50% further before pain kicks in. That's a big deal. 40 to 50% more walking before you get pain. That ability to walk further helps condition you and helps your body build those collaterals. And we'll talk about that a little bit later. Here's a big caveat. People with heart failure can't take cilostazol. That's a hard stop. But for many others, it can be very helpful. Now, again, I'm not telling you what to take and what not to take. I'm giving you tools that you can talk with your own doctor about from a place of understanding. It's been demonstrated multiple times that if people are knowledgeable and engaged in their health care, your outcomes are so much better. Some people will say, well, Ford, you're setting up people for DIY, do-it-yourself medicine. Not so much do-it-yourself medicine, because I wouldn't agree with that either. Do-it-yourself implies that you don't have a navigator, you don't have a guide. What we're doing is setting people up to have a guide, to have some knowledge, and to be engaged, because that makes such a better outcome. And that makes sense because lifestyle is so critical for good health. Now, let's talk about supplements for a few minutes. People can say, well, why should I take prescription medications when I can take a supplement? Most supplements don't have as much evidence, at least it's not very strong, for peripheral artery disease. Now, there are a few that show promise, and you probably guessed it if you've been watching our videos recently, L-citrulline. L-citrulline is the supplement that has some of the best evidence so far in terms of helping with PAD, peripheral artery disease. This study that we're going to show in a minute was also set up with BH4. You don't need to remember all that, but it showed better microcirculation in peripheral artery disease patients. Now, here's another one that you've heard of. You won't be surprised, I don't think, omega-3s. There are actually even prescription forms of omega-3s. And for those of you who might remember, it's EPA and DHA. In studies, these improved inflammation and artery flexibility, but usually more at medical doses, 4 grams and more. Vitamin D and folate, low levels are linked with worse vascular health. So make sure that your vitamin D and folate are appropriate and replace them if they're low. I think of all these as supporting tools, not magic bullets. They do not replace lifestyle. They don't replace core medications, prescription medications when those are needed either. Sometimes PAD, peripheral artery disease, becomes severe enough that lifestyle changes and medications just aren't enough, especially when pain happens even at rest. When there are open sores or ulcers that just won't heal. When your toes are turning dark or even black. At that point, you're not just trying to feel better. You're trying to save that limb, that leg, and sometimes even save the person. Doctors may talk about what's called revascularization. Vascular means the vessels. Vascularization means to increase the vessels, and means to do that over again. So what they're talking about is restoring blood flow. If you go to see your doctor and you hear the term revascularization, he's talking about restoring blood flow to that limb. There are two main approaches. Endovascular procedures are first. Endo meaning inside, vascular meaning the vessels. So inside the vessels. This is working from the inside. You thread a thin wire into the artery. You open it with a balloon, sometimes place a stent, sometimes shave off plaque. It's less invasive and often used for shorter blockages. The second way is a surgical bypass. That's building a detour around a longer or more complex blockage. You use a vein graft or synthetic graft. It's a bigger operation, but sometimes it's the best option. In the most severe cases, critical limb-threatening loss of blood supply, time matters. You need a team. Vascular specialists, wound care, infection control, and you got to get that limb revascularized. You got to get blood supply back to that limb quickly. These procedures can be life-saving and limb-saving, leg-saving, but they still don't fix the root cause, the metabolic and inflammatory environment that started this process in the first place. And in most cases, that went on for decades before the leg got into that kind of shape. So all of these procedures, these medications, think of them as just buying time while you work aggressively on the underlying inflammation process that started it in the beginning. You know what they say, when you find yourself in a hole, the first thing, stop digging. So let's talk about something else for just a second. Before I get to the number one simple strategy for PAD pain, peripheral artery disease pain, I want to tell you why I started traveling to patients' homes. Most people with peripheral artery disease and plaque in general have never had anyone really sit with them and look at the whole picture, how they move, how they talk, what they understand about their arteries, what they eat, how they sleep, what their home environment looks like. So I started doing something I call house calls. I travel to people's homes. I spend the time that regular clinic visits just don't allow. We look at their labs, their lifestyle, their tests. We walk through their daily habits, both literally and figuratively. We've started filming some of these visits with their permission for a new series called Dr. Brewer's House Calls. The first episode follows a patient in Texas who's dealing with serious mobility issues and circulation problems. You'll see the whole process, what we measure, how we think through the risks, and what it takes to turn a chronic problem around. 48% of U.S. adults have vascular disease. It's the number one cause of heart attack. In this series, I'm traveling all over the country to help people cure their chronic disease.
He has definitely told me, I don't want to live anymore. The pain is too much.
We have to get him walking.
We like to go camping, and she loves to go for walks, and I can't walk very far.
And you can't go.
No.
Harlan's got over 50 years worth of the worst thing you can do to your arteries, smoking.
I don't really want to scare Harlan and Linda, but I really struggle trying to find a pulse.
The series premieres here on YouTube on December 13th. If you had peripheral artery disease, or even just suspicious leg symptoms, the question that usually rises to the top of your mind is, what's the simplest, most proven thing I can do that doesn't involve more medications and surgery? The answer will sound almost too simple. Walk. If you're having peripheral artery disease, you're not quite ready for that. I'm talking about just a structured walking program. Here's how it works. You walk at a normal pace until your leg symptoms reach mild to moderate discomfort. Not unbearable, just enough that you notice. Then you stop and you rest until the symptoms settle down. Then you start again. You repeat this cycle 30 to 40 minutes. several times a week, 3 to 5 times per week, over time, your body starts getting the message. We need more circulation down here to the leg muscles. And in response, your body starts to grow things that we call, and we mentioned them earlier, collateral vessels. Those are tiny new blood vessels that act like back roads around a blocked highway. You've been on a blocked highway, and what happens is people start going off on the next exit and go around that blockage. That's what collateral vessels are like. You may not fully remove the original blockage. That's not the goal. You want to create new paths, and the muscles get more blood through the new paths. But that's not going to happen until you push those muscles, push your body, stress your body to get oxygen to those muscles. You got to go through a little bit of discomfort. I hate to say it. Some people react very negatively to the term no pain, no gain. But what we're looking for is not pain in the joints, not knee pain or anything like that, or hip pain. We're talking about discomfort in the muscles that are starving for oxygen because of that blockage in your artery. Studies show that people who followed structured walking programs walk longer before pain starts, go further overall, and report a better quality of life. In many cases, this simple, consistent walking program outperforms medications for reducing everyday symptoms. You pair this walking program, and then you walk more and more. And if you get up to the point where you can do some pushing into sprinting, when you do those, and you keep from adding further fuel to the fire. In other words, you eat a low-carb diet, you keep your blood sugar down, you keep your insulin down, your body can and will heal. That's why you're listening to this in the beginning. If walking is too painful right now, or your legs just won't allow it, you can still help your circulation. Try stationary cycling, recumbent bikes, even those things with they call them arm ergometers, where you're moving your arms around like this. Anything that helps push oxygen deprivation to your muscles can improve cardiovascular conditioning while you build toward more walking. Warm-ups help as well. Something as simple as a warm shower, a heating pad on the thighs or calves, a warm electric blanket before walking. All these can help increase local blood flow and reduce stiffness before you start. No, this is not a cure, but it can make those first steps less miserable. Now, if you're still here, a couple of resources if you want to go deeper. If you'd like to help us save lives with this channel, it's easy, simple, and completely free. Just subscribe. And if you'd like to see how I help patients protect their arteries step by step, download my free 7-step heart attack prevention guide. It's linked below. And if you're watching on a TV screen and you have a big QR code, just take your phone and, like you're going to take a picture, you'll see a link come up right under that. If you're trying to get your health back, maybe you've been frustrated with your current care or overwhelmed by all the conflicting advice that you hear online. You're not alone. Years ago, I had to dig deep and figure out what was really happening inside my own arteries. And that's why I built our clinical time, to help people just like you take control of their health before a heart attack or stroke takes control of them. If you're ready to take the next step, just call us at 859-721-1414. That's 859-721-1414. Or click the link below. We'll walk you through your options and help you find a plan that actually fits your goals. And if you're not quite ready for that, that's okay. You can start with our free 7-step heart attack prevention guide. It's linked below. Now, how to check this risk at home. This sounds like some of the stuff I've got, but I'm not really sure. There's a simple way to clarify, get more information. There's a test called ankle brachial test, or ABI. It compares blood pressure at the ankle with blood pressure in the arm. There are ways to approximate parts of that with a simple home blood pressure cuff. I walked through that process in another video. You can watch that one right here.